Hi everyone, I'm Dr. Sayali Gadre, consultant obstetrician and gynecologist at Yashodhara Superspeciality Hospital, Solapur. Today we'll be discussing the most Googled questions of the first trimester of pregnancy. So first question most of the females have is, how does baby develop a course of first trimester? The baby develops from very few cells to over a size of millimeters, that is at least 84 millimeters till the end of first trimester. During this period, there is growth of brain, heart and nervous system. There is an extremely fast development during this period as it is a most critical period for the baby. Most of the anomalies tend to happen during this period of time. So hence you need to be more careful for it. The second question here is, what food should you avoid during the first trimester? All the home cooked foods are safe. Outside food obviously should be avoided, like Chinese, the food with excessive preservatives, sugars, high in sugars, or papayas, pineapples, uncooked fish, sushi are to be better avoided. Can you take a painkiller during the first trimester? Yes, it is recommended, but only prescribed by an obstetrician, the one which is safer in the pregnancy. Avoid self medication. Some kinds of aches and pains are common during the first trimester, but if you still require an help, consult an obstetrician. How much weight should you gain during the first trimester? Usually, this answer depends upon your present BMI or your pre pregnancy BMI. If anywhere it is between 19 to 24.9, the average weight gain should be 7 to 11 kgs. And during the first trimester, you can gain up to 5 kgs, then 3 kgs in second trimester, and 3 kgs in the third trimester. So, this is as per recommended by WHO. What are the precautions that you need to take during first trimester? Avoid long distances travel, avoid sexual intercourse, avoid weight training, vigorous exercises, avoid lifting of heavy weights. And we obviously do not want you to take a bed rest completely, but you need to be active and you can also continue your job. What are the most common symptoms experienced during the first trimester? There can be nausea, there can be vomiting, there can be breast tenderness, lower abdominal pain, sometimes period like pain, generalized weakness, also mood swings. What are some tips to improve nausea and vomiting in first trimester? Start your day with small amount of food like dried toasts or dried biscuits. The food which does not contain smell that can be had like fruits or breads can help. What if you have spotting during the first trimester? If it is the most common symptom experience, it is normal most of the times because it is called as implantation bleeding. But if you have severe cramping and active vaginal bleeding with passage of clots, it can be a sign of miscarriage. And yes, you need to consult an obstetrician for that and also perform an urgent sonography. Is it safe to exercise during your pregnancy in first trimester? Yes, it is safe, but do not perform any weight training exercises. Brisk walking is enough. Do not try something new which you haven't done prior in the pregnancy. And obviously, you can do yoga, but under training and supervision. When should you consult your obstetrician for regular pregnancy checkup? As soon as you find out that you are pregnant and your test comes positive, consult your doctor so that they perform a physical examination, check your weight, check your pulse and BP, advise you some blood test and urine examination, calculate your gestational age, and schedule an appointment for your sonography. Thank you.